And greetings, everyone. Thank you for joining us today for Count the Kicks, how to bring the successful stillbirth prevention program to your state. We have two of the wonderful speakers from our presentation today joining us today in Zoom for this Q&A. If you have questions and you did not add them to the questions tab in the conference platform, that's absolutely okay. You can add them to the chat here. You can also unmute yourself here and share your questions. There was a lot of great conversation and kudos being given in the chat, so we can also continue that as well. This is also a space for reactions and comments. But with that, actually, I should have introduced myself, but I will say my name is Christina. I'm a senior program manager at AMCHP, and I'll just be moderating the session. My fellow AMCHPer Justin is also here with us to help with the question Q&A. And if I could pass it over to you, Emily and Kim, if you could introduce yourselves, and then we can kind of enter into a discussion about the presentation.
Sure. Thank you, Christina. I'm Emily Price. Thank you all so much for joining us. Executive Director of Healthy Birthday, Inc., the nonprofit organization that created Count the Kicks. And I'm extremely grateful to have Kimberly Piper on the call with us today. Kimberly, would you like to introduce yourself?
Sure. I'm Kim Piper, and I'm the Executive Officer for the Center for Congenital and Inherited Disorders at the Iowa Department of Public Health. And one of the programs that I oversee is our stillbirth awareness and prevention campaigns. And I am also a former labor and delivery nurse in my first career life.
Thank you, Kim. We'd be happy to open it up to any questions that you may have. And if there aren't any immediate questions, I'd love for Kim to talk more in depth about the work that you do. In addition to Count the Kicks, there is no doubt that the reduction of stillbirth happened in Iowa, not just because of our campaign, but because of the work that Kim is doing. As Kim reviews, and I don't want to put words in Kim's mouth, but as she reviews fetal deaths that happen in our state, and she notices any gaps of potentially an expectant parent coming in, noticing a change in movement, and perhaps protocols weren't followed, or baby is lost after mom wasn't listened to, or perhaps tracking, paying attention to fetal movement wasn't educated or explained properly. Kim is the person in our state who has brought systemic change to, I think, the providers in our state, listening to moms, teaching this, educating properly. But Kim, I don't want to put any words in your mouth. Would you like to explain a little bit more about the work that you do? And of course, we're happy to answer any questions that anyone has along the way. So.
Sure. Just going back to what Emily mentioned, we have hospitals that voluntarily submit to us what we call fetal death evaluation protocols. So whenever they had a family experiencing a stillbirth, they fill out this form and send it to me. And the form has a lot more information than the fetal death certificate does, including an opportunity to interview the patient or the family, the woman and her family members, just for their perception of the way events occurred, if there's any information that they would like us to know. We can ask things like, which side do they routinely sleep on? Some research is ongoing about the impact of laying on your back routinely when you're pregnant, those types of things. So those are questions we can ask of the family that we wouldn't be able to discern from the fetal death certificate. So anyway, these forms are submitted to me, and occasionally through the interview or the comments provided from the family, we'll learn about a lack of awareness, if you will, with the provider, and that they didn't necessarily act on the information that the woman was giving them at the time regarding her fetal movements. So there's one circumstance that I can recall where the pregnant mom felt her baby wasn't moving as much. She called the hospital triage nurse, that like dial a nurse, 24/7 call line that you have. And the nurse said, just, drink some orange juice, see if the baby moves. Otherwise, call back in the morning if the baby hasn't moved by then, or call your doctor in the morning. And unfortunately, when she did go to her doctor's office in the morning, her baby had died. So I reached out to that organization and talked to them about the protocols or the information that they relay to women when they call in with similar concerns or complaints. So, and there have been situations where the provider will not have the woman come in for evaluation when she reports that her baby's movements have changed. And we are able to reach out to those providers through our statewide perinatal care program, which is a group of individuals that there's a maternal fetal medicine physician, there is a neonatologist, there is an OB nurse and a NICU nurse, and they go out and visit every hospital in Iowa on a regular basis and provide education, and we'll meet with staff and providers individually about certain issues that they have concerns about, or if we go to them and say, hey, this facility or this provider has kind of missed the mark in this regard. And if you guys could go out and talk to them and bring them up to speed on what they need to be doing, that would be good. So the physicians from our statewide perinatal care team will go out and have a conversation with that provider about this. So we tried to take not a punitive approach, but definitely an education and awareness approach, so that hopefully this will never happen again.
Thank you, Kim. Thank you for your explaining that further in depth. Does anyone have any questions that they would like to add or ask? I noticed that we have a few states on here that maybe don't have Count the Kicks yet. And so we'd be honored to answer any questions you have about possibly bringing Count the Kicks there. One of the things that we are learning as we work with femurs across the country and what they tell us is about 55% does that we don't. So when we work with femurs across the country, they tell us about 55% of expectant parents or moms who lost a baby to stillbirth noticed a change in their baby's movements, but had never been told or never educated that that was a red flag, that they needed to call their doctor, that they needed to go in. And so that is this very specific gap that we're trying to fill, is that expectant parents deserve this education. They deserve to have healthy deliveries and healthy babies. And this is one way to help make that possible. Does anyone have any questions we can answer? If there aren't any questions, some other things that I would tell you, and feel free to jump anytime, is that the campaign is ready to go and it's low cost. So depending on the cost depends on the number of live births that you have in your state each year. So in Iowa, we have about 36 to 38,000 live births each year. And the cost is based on wanting to give 2 to 3 touch points every single year to those expectant parents. That could be a brochure handed to them by their doctor, seeing a social media ad on Facebook or Instagram. It could be a news story that they see in the news. It could be a billboard. It could be attending a community baby shower and learning about us. The more and the different number of ways that we can reach expectant parents, the better in each state. And so we also offer an a la carte approach. So if you come to us and you say, I have $25,000 and that's what I have this year to help prevent stillbirths in my state, we can work within that. And if you're from a smaller state or one of our smallest states, it's going to be even less than that because you don't have as many expectant parents. So it is low cost. And when I say turnkey, our team, our program director, Megan Ockett, is on this call as well, does a lot of the heavy lifting. So ordering our materials is taken care of. We have a fulfillment center. As we mentioned in the program, people just go to our website, order the materials, like going to Amazon. They get them in their cart, and your birthing hospitals, your doulas, your home visitors get them within 7 to 10 days and can start implementing the program right away. The things that we need from our partners are things like inviting us to speak on webinars to educate your birthing hospitals, to educate your home visitors, to educate your doulas. Anyone in your state who serves, cares for an expectant parent needs to learn about this so that they can share this education. Our website has a host of free resources already available to people in your state. And again, this is an evidence-based campaign. One thing that we did not touch on in the presentation is a white paper that we have out. It just came out last month that talks about the link between stillbirth and maternal mortality and morbidity. And what the research shows, just like the CDC has in its Hear Her campaign, 15 urgent maternal warning signs that a change in a baby's movement is one of the 15 urgent maternal warning signs. Not only is a change in a baby's movement could be an indication that something that has developed in the pregnancy that needs to be investigated by a doctor or a nurse, it could also alert mom to issues developing with her health, things like a maternal fetal hemorrhage, a placental abruption. Research shows that if mom gives birth to a stillborn baby, she's now 4 to 5 times more likely to lose her own life. So of the 700 moms that we lose in this country each year to maternal mortality, at least 22 of them are related to moms giving birth to a stillborn baby. The health of it sounds obvious, right? The health of a mom and the health of the baby is intrinsically connected. And that's why Count the Kicks is vital as an urgent warning sign. If your baby's movements have changed, you need to call your doctor. You need to go into your birthing hospital. The CDC is talking about this in its Hear Her campaign, and Count the Kicks has been here for a dozen years, educating expectant parents about exactly that urgent warning sign, that red flag. We know that there has been a 32% stillbirth rate reduction in our state, and within that, a 39% stillbirth rate reduction among Black women. And this is exactly what we want to see in your state. Every time we launch in a state, this is what we want to see. And we believe it can happen in your state. So we started, as you could see on the slide, in the Midwest and branched out through the Midwest. And then we went to the South, Florida, Georgia, South Carolina, Alabama. We have another Southern state coming on within about 6 weeks as well, because their stillbirth rate doubled during COVID. And we know COVID is having a huge impact on pregnancies and is increasing the stillbirth rate in some states. So I'm kind of rambling now, but happy to answer any questions you have. I see a current partner, Tommy, in Alabama. Thrilled to have him on. So Tommy, if there's anything you would like to add about how it's going in your state, or Kim, anything you would like to add about how it's going in Iowa and how it's been going. Kim is an early influencer of this campaign. In fact, she said to our founders, have you ever thought about educating expectant parents on this issue? Because 15 years ago was a real gap in education, and now we're working toward filling that gap for all moms and all parents. So any questions, anything you'd like to add, Kim, Tommy, or anyone else?
I would just like to add, oh, I'm sorry, Tommy, go ahead.
No, go ahead. Go ahead.
Oh, okay, this will be quick. My boss in Iowa is our state Title V director. And the support that I'm able to provide and the health department is able to provide to Count the Kicks comes from our Title V programming. So we're all AMCHP here, so we all know about Title V. It was a very small monetary-wise investment in Count the Kicks in Iowa, but it has the return and the benefits are obvious. And I just encourage anybody to reach out to your Title V program in your state to see the ways that you could possibly work with Count the Kicks in your state.
Thank you, Kim.
Yeah, in Alabama, Count the Kicks is something that that our Alabama Public Health has been working with for a while. But I was just introduced to Megan through a webinar a couple of weeks ago, and it just so happened that it was going to be just the timing was perfect. We were about to have an Oral Health Coalition meeting, and so one of the target audiences that y'all have developed now are dental offices. And being the dental director for Alabama, that's absolutely a perfect partnership that that we can have with Count the Kicks as well. So at our Oral Health Coalition meeting, we had representatives from all over the place. And I was just chatting with Megan in the chat box, and one of the organizations that was there was community. It's one of the community colleges here in Alabama that has a dental hygiene program that has just started this year. And so she took samples of all the different materials from the toolkit back, and she is so excited to go back and implement it in their program. So, this is just one more connection to what we realize every day, and that is that oral health is connected to overall health. And so that's what we stress. That's what I try to get across to folks. And one of the other things too is that being in private practice for 28 and a half years and then coming to public health, I've only been here for 4.5 years. But one of the big disconnects that I realize is between the public health aspects of dentistry and the private sector. There's so many different types of things that are available from public health that the private sector, as far as dentistry, has at their fingertips that they just don't even realize. And that's one of the other things that I'm trying to do, is to break that disconnect and make sure that everybody knows what's available for everybody else. So thank you.
Thank you so much, Tommy, for the work that you're doing in Alabama. We really appreciate it. Tiffany, you had your hand up. What would you like to ask?
Yeah. Hey, everyone. My name is Tiffany Bao. Yeah, I work over at the Minnesota Department of Health. And yeah, I was looking at the list of states that are partnered with Count the Kicks, and I don't see Minnesota on there. And I'd be interested in bringing just some more information back to my colleagues, my supervisor, and share this with them and see if there is a fit anywhere. And so I guess I know while I was watching your webinar, you all listed kind of just like some of the things that you all offer. And I'm just wondering if there's, I'm checking out your website right now too, to see if there's like a list out there with all of the things that you all offer, so that I can just bring that back to my group as well.
Absolutely. I can send that to you in a PDF, and that raises a good point, that there isn't sort of like a toolkit on our website for potential state expansion partners of like what it looks like, but that's a great idea to add there. But I'd be happy to send those to you. One of the things that we're really proud of in recent years, in the last 4 years, and I'm going to look at my drawer to find it, is some of our picture-based materials. And of course, I'm not going to be able to find them. Here they are, picture-based materials. So you saw on the webinar, the presentation, some of our yellow sort of Dr. Seussical brochures. And these are what have been in existence for over a decade in our state. But one of the things that we're proud of in recent years are the picture-based materials for potentially refugee populations. In fact, these were developed, Tiffany, in Minnesota. And so as you can see, there's minimal wording. So this might be for someone who's new to our country, who, it makes kick counting extremely easy to understand if English is not your first language. And so this is something, for instance, we launched in Arizona within the last year. Absolutely. I'd love to email you, Tiffany, and send you our information. When we launched in Minnesota recently, they said, can we please have these in Navajo? And so they changed the image on the front to look like a Navajo woman from their state, and we got them translated into Navajo, in addition to a couple of other languages. And so that's something that we can tailor to a state's specific needs. All of our materials can be translated into additional languages, and our app that is in 14 languages can also be translated into additional. So while we know this has worked in Iowa and in many other states, every single time we launch somewhere, it is tailored to what fits your audience of expectant parents, to what fits your needs and your strategies in your state. And so we know that it's not always one size fits all, even though the campaign has been pretty darn universal in helping get babies here safely. We want to tailor it to fit your needs. So Tiffany, I will be happy to send you that sort of packet of information and reach out to you by email. Thank you.
I want to jump in with some gratitude and thanks. We're not over. We have some time if there are additional questions, but Did want to jump in, but thanks for how the conversation has been going. I myself have learned so much just being in this space, especially the point you were making, Emily, about the connection between maternal mortality and stillbirth. I had not heard that before. And it is just, I mean, of course, there is that mom baby, that birthing parent baby dyad of connection. Of course, there would be a connection, but still, it is so crazy to think that there's that relationship. And we know that there's also a high rate of maternal mortality in our country as well. I had a question for you, and well, two questions for you. One being, you mentioned a white paper earlier about some Count the Kicks data, and I want to know if it was possible to share that in the chat, because I'm sure that we would love to see it. And my second question is, I was part of this presentation yesterday, but a presentation about storytelling in maternal mortality review, as well as fetal and infant mortality review. And my co-presenters from the National Center the National Center for Fatality Review, pardon me, as well as from the Delaware State team. We're sharing the significance and importance of raising stories and connecting stories to the data that is being collected from the mortality review process. And something that really stuck with me from the presentation was Jasmine's story about her own experience with losing her own son, unfortunately. And I just wanted to know if you do any more connection of that story to raise awareness and advocacy for Count the Kicks, or if you have done any other work about, for lack of a better word in this moment, but adding that additional incredibly human element. I don't think many people are aware of the people in their communities and just how widespread and how interconnected this experience unfortunately is. And so I just am interested if you have thought about doing any more work in that realm, or if you do any more of it presently.
Christina, that's a great question. And thank you for asking it. I do think storytelling is extremely powerful. Stillbirth is something that has been so taboo in this country for so long. And I feel like we're finally getting a little bit more out of the shadows, but not nearly as out of the shadows perhaps as we should be. We need people to talk about it, because if we're not talking about it, then we're not addressing it, right? And so that's part of where our organization also tries to bring that to the forefront. And so we do on our social media platforms try to, we do often share the stories of expectant parents or lost parents who have endured the loss of a baby, and elevating their stories as a way to do that. We also recently launched a platform called stillbirthstories.com, and Stillbirth Stories on Facebook, Instagram, and Twitter. It's just called Stillbirth Stories. If you look it up on Facebook, Instagram, and Twitter, you'll see stories from mostly women across the country, some men as well, who have endured the loss of a baby, and in many cases, a full-term baby, and what that experience was like. We do have some advocacy work, and this is not to influence anyone on here in any way, but simply an awareness, I would say. We do have a bill in Congress right now that we've been working on. It's a bipartisan bill that would add the word stillbirth and stillbirth prevention to Title V. Would you believe that since 1935, when Title V was written, stillbirth was never named in Title V, and neither was stillbirth prevention? Many important things are named in Title V. It is a symbolic effort to raise awareness that Title V funds can be used on stillbirth prevention efforts. All of the states that we partner with, as Kim mentioned, the ones that we do partner with use their Title V MCH block grant funds to partner with us. And so some states maybe don't even realize yet that you can do that because it's not listed there, but it is an allowable use of funds already. And this bill would simply add that as well. It would be a technical change to Title V to really shine a light on the fact that you can do that. Related to storytelling, I think with Count the Kicks is not only the storytelling of loss is so powerful and important to a public dialogue, but in our work, the storytelling of the saves is so powerful. And we didn't add a video into our presentation, but we have loads of them on our website and our social media channels of moms who simply used our app It created a red flag for her that there was an issue in her pregnancy. She talked to her nurse or her doctor. They investigated and handled it appropriately and found a way to get that baby here safely. In many of those cases, the doctor or the nurse will say, you know, had you not come in, had you not known about this, had you not spoken up, you would have had a very, very different outcome. And when we get those stories, because people will email us or they'll message us through the app, or they'll tell us on DM on Twitter, or actually on TikTok. We launched on TikTok a month ago or so. We've already saved 2 babies on TikTok. The mom to mom sharing is so powerful. The first week that we were on TikTok, a mom saw the message, ultimately ended up noticing a change in her son's movements, spoke up and told her doctor. Long story short, baby got here safely because of it. Mom shared the story on TikTok. It helped save another baby. It's that kind of powerful sharing that leads to baby saved. There is power in moms sharing. There's power in expectant parents, birthing people sharing. And that is what we try to do. One last anecdote related to sharing stories is there's a baby in our area named Ruby. She's now 4, actually. Her mom was using our app and told her story locally so powerfully that it was picked up by Good Morning America and Inside Edition and Today Show Online and USA Today and many others. And it led to a 3,700% increase in app downloads of moms saying, oh, that mom, you know, used our app, got her baby here safely. I should download it too. In fact, there was one mom in our same community that the story was on Good Morning America in June. Another mom needed it and saved her baby in August. And then there was a mom in Nebraska that saved her baby not long after. It is a ripple effect when we all come together to educate, to empower, to give parents this really simple, life-saving education that they deserve. And so I thank everyone on this call who is already doing this. And for those of you that have interest to do it, the power of what you're doing is profound. It is profound. And even if only one baby is saved, that's amazing. Look, like you saved a life. But the idea that you could have the power of a 32% reduction is amazing. And what we can all do together as a community, I think, is huge. So thank you.
Thank you so much for sharing that. Even the power of that story in this moment of hearing about just the spread. I love hearing about TikTok being used as a mode to spread health and positive and correct health information. Oh my gosh, that is so wonderful. I saw you unmuted, Justin, sorry. Oh, we can't hear you. Take your time. No. Is your computer muted maybe? All right, we'll give you a second. But while you're working that, I did, as you were talking, Emily, I had one additional question. Oh, sorry, I saw you unmuted, Kim. Did you want to go for it?
No, I was just going to say at a staff meeting, we were talking about stillbirth, and I asked out of 40 people in our bureau, how many of them had a personal or close, a loved one with an experience with a stillbirth. Every person but one raised their hand. So, but nobody would ever know that because it's just not talked about. So yeah, sharing is believing. Yep.
Am I able to be heard now? Great. Thank you so much again for the recording and the presentation. It actually, the previous comment just prior when I was trying to ask a question. So it is like folks from everywhere can technically download the app, right? Not necessarily having a state-based campaign or something like that. In those instances then, and this was a separate question that I had thought of, was in the recording you had mentioned that there was also some like local resources that could be referred, I guess, within the app. And how are those resources being selected, I guess, to address the social determinants of health? And is it like, you're collecting recommendations of resources, or like a big list, like 211 or something like that?
Hey, great question. So in the two states that have that social determinants of health survey is Iowa and Kansas right now. When we launch in additional states, if that's something that they would like is the social determinants of health survey, we can provide that if that's what the state would like to do. How that decision is made is based on what the public health department would like to do. So in Iowa, it's the Iowa Family Services Network. And I'm going to blank on what it is in Kansas, but Megan, our program director, is on here and can let us know. But it's something similar. It's something that the state has chosen that they know is a proven tool to help get folks the help that they need, whether it's safe housing or 1,800 children. Yeah, and so here's something notable. We launched this in the fall of 2000, so right in the thick of the pandemic in Iowa. And Iowa's a relatively small state, 38,000 live births or so each year. In the first month of that survey being on our app, 400 women in 1 month in Iowa said, yes, I need help in this area or that area. And then they were connected to the resources they need. We know what the pandemic has done on families across our country and how it has exacerbated disparities and made access worse, more difficult to come across food and safe housing, transportation. And so this is, Megan says we're doing a presentation on that this evening, 100% response rate. Yeah, I mean, it is another way to help improve outcomes that are not just stillbirth prevention in your state by having that resource on there that is tailored, hyper local, enter your zip code, get connected to what you need. Yeah. Thank you, Justin. Megan mentioned it on our website. So Healthy Birthday is the name of our 501c3 organization. And so you can see that link on our website. Healthy Birthday is the name of the 501c3. Count the Kicks is the name of the prevention program. And you can see the Find Help resource. So if you're on our website as well, you can find it on there. And the app has been downloaded on all 50 states and in 140 countries. So it absolutely is a free resource for anyone, anywhere to use at this point. So a launch in a state is the things like the materials where the health department or an insurance company makes these free. So it sparks the kick counting conversation between doctor and patient, or doula and patient, or home visitor and expectant parent. And it really keeps it top of mind. It's amazing. Even providers may not go to the great length of ordering these materials and paying for the shipping unless it's there, and it just really breaks down a huge barrier if a public health department uses their block grant funds to make these free and available and quick and easy campaign to implement.
Wonderful. Thank you. And thank you for Megan for sharing additional resources and links in the chat. If you haven't seen them, please go check them out. We have just about 10-ish minutes left with one another. So I want to hold space if there are any additional questions or comments for our presenters. Already some fantastic questions have been asked. So if anybody else interest has been piqued and they want to join the conversation. If no one jumps in, please pardon me. We can end a couple moments early. That's totally fine. I do have one last question, if it's okay. And that is in my previous work. So before I was at AMCHP, I worked with family medicine providers, family medicine residents actually, on a preconception screening tool quality improvement initiative. And something that was very impactful and effective with them, it was adding questions and information to the chart when they were having conversations with their patients. In this project, they were talking to parents of children, the mom specifically, when they brought their child in for a well child visit. And I wanted to know if there's ever been any conversations or discussion about adding Count the Kicks specifically as a part of a preconception care visit, like checklist. I'm making things up, but like really codifying it in that way to support the spread and like the conversation happening between the provider and parent, knowing, you know, not everybody is linked as early as they can be to their preconception care, but still, has there like been any discussion or thought about what that could look like?
That's a great question. Absolutely. I think there are some doctors and provider groups that do that. And then I think there are some that don't. We have been also endorsed by the International Childbirth Educators Association. And so we have on our website a downloadable 2-page childbirth ed lesson plan that they can use at hospitals, or any childbirth educator can use it to have that conversation. And I guess that would be in childbirth ed. So, but you're talking about preconception. I would say that is not as common a question as we even have some doctors coming to us and hospital groups coming to us and saying, like, what's the protocol if we know if a mom comes in with a change in movement? I'd say that is actually sometimes a more common question, which is a little concerning to us. I think there are a lot of groups that do have a protocol in place, and there are still some that don't, which is extremely concerning, right? And so that is part of why we need to expand and why we need to have these conversations in your state. So every doctor, and we actually have some pilots that we're doing because even though we are not medical experts, it is an evidence-based campaign. We don't pretend to be the experts. We want the doctors to investigate and make that informed decision on what to do next. If a mom comes in, we are working with, well, I can't say it yet because it's not official yet, but we'll be working to pilot some of those kinds of things that you're mentioning, Christina, so that it is more common practice, commonplace, and standard of care to have these kinds of resources for expectant parents. And I'll leave you with our best story. There's baby Ruby on Good Morning America in case anybody wants it.
I love it. And actually, perfect. We can conclude here if that's okay. And I think ending on the high note of baby Ruby, we can all click and watch as we transition would be the perfect way to culminate our conversation today. I just again want to say thank you to Emily. Thank you to Kim. Please convey our thanks to Jasmine for your presentation and sharing the story and this work with us today. Please give a virtual round of applause and thanks to our presenters as well in the chat if you would like. There's still some more things coming up at the AMCHP conference today. I believe we're going into a break, but there is a plenary session this afternoon, as well another group of workshops for those of you who will be joining us for them. I hope you do. They will be fantastic. We have people sharing their why they do this work, why they are engaged in public health this afternoon or evening, I should say. So please join us for that. But with that, thank you so much for joining us. We're really, again, thankful to our partners at Count the Kicks for this presentation. With that, have an enjoyable rest of your day and rest of your conference. Thank you.